My name is Dotty Nygard. I'm a registered nurse of 30 years in our emergency room department here at Sutter Tracy in Tracy, California. We use limits in our department and see better outcomes. I've witnessed better outcomes. I've been involved with better outcomes. We're responsible to leave the department to transport critical patients up to the critical units. We do have a flexibility amongst the staff to be able to know that our patients that we are leaving behind on our assignments are well looked after. So I totally credit that to the fact that we have ratios and limits in our department. We get a lot of nurses from, out of state that come to California because of the fact we have limits and ratios in place. And they are just amazed that, they can provide better care, longer times at the bedside. We can only be stretched so thin. And when you give a nurse an unthinkable assignment of 6, 7, 8 patients, it's got to give somewhere, and unfortunately it's the patient that usually ends up suffering. There's many stories that I can actually share about before ratios, before limits. With 2 or 3 nurses in a full department, it was, I look back, unthinkable. You almost feel like you're being defeated when you are, challenged with such high volumes like that. So yeah, I can definitely remember many stories, many nights, almost in tears. They will throw the rhetoric out there to say, oh, it's going to be way too costly, see what you're going to do to our community, you're going to limit access, you're going to, make us, raise cost. No, don't fall to that. And it's already shown that it's improved the outcomes in California. Limits work. We applaud you in California for taking on this fight because honestly, we as nurses want this across our nation. Our patients deserve safe limits. So go get them, Massachusetts. We are going to stand behind you, support you, and in solidarity, we wish you the best.